we are going to look at the we are going to begin our discussion on the musculoskeletal anatomy of the lower limb. The regions of the lower limb, you must know them because we are going to be looking at this musculoskeletal anatomy in regions. For example, you must know the thigh, which is between the hip joint and the knee joint, the leg, which is between the knee joint and the ankle joint, and the distal to the ankle joint to have the foot. On the posterior aspect of the pelvic girdle, because this is the pelvic girdle connecting the lower limb to the trunk. So on the posterior aspect of the pelvic girdle, we have a region known as the gluteal region. This gluteal region is the region of the buttock. The region of the buttock is known as the gluteal region. And it is part of the pelvic girdle, the posterior aspect. And the pelvic girdle is part of the lower limb. So we are going to first look at the musculoskeletal anatomy of the gluteal region, which is the posterior aspect of the pelvic girdle, also known as the buttock region. The gross anatomy of the osteology of the lower limb, let me hope you are doing it because it is very key to your understanding this musculoskeletal anatomy. But to remind you, to show you some of the important ligaments of the pelvic basin, this ligament, we talked about it last semester, known as the inguinal ligament, which stretches from the pubic tubercle to the anterior superior iliac spine. And this inguinal ligament is made up of the aponeurotic fibers of external oblique muscle. It is the inguinal ligament. We talked about it when we were looking at the inguinal canal. Then there is a ligament between the sacrum and the ischial spine. Between the sacrum and the ischial spine. And this ligament is known as the sacrospinous ligament. The sacrospinous ligament. And then there's another ligament between the sacrum. This ligament is between the sacrum and the iliotibial. Between the sacrum and the iliotibial. And this ligament is what we call the sacrotuberous ligament. So, the sacrospinous ligament and the sacrotuberous ligament are going to convert the greater sciatic notch and the lesser sciatic notch into a greater sciatic foramen and a lesser sciatic foramen. When you look at the posterior aspect of the pelvic bone, you have what we call the greater sciatic notch and a lesser sciatic notch. The greater sciatic notch and a lesser sciatic notch. In between them, we have the ischial spine. And this bone is known as the ischium. It has an ischial spine and an ischial tuberosity. And the ischial spine is between the greater sciatic notch and the lesser sciatic notch. So here, these ligaments, the sacrospinous ligament and the sacrotuberous ligament, the sacrospinous between the sacrum and the ischial spine, the sacrotuberous between the sacrum and the iliotibial. These two ligaments convert the greater sciatic notch and the lesser sciatic notches into the greater sciatic foramen and the lesser sciatic foramen. And these openings are very important when we are looking at the muscles of the gluteal region, and they are bilateral on both sides. So study the osteology of these bones in details if you are to understand musculoskeletal anatomy. We saw the brachial plexus supplying the muscles of the upper limb. The muscles of the lower limb are supplied by both what we call the lumbar plexus and the sacral plexus. And there is a connection which is known as the lumbo-sacral plexus. So spinal nerves L1, L2, L3, and L4 form what we call the lumbar plexus. And spinal nerves L5, S1, S2, S3, and S4 form what we call the sacral plexus. Both the lumbar plexus and the sacral plexus contribute to the nerve supply of the lower limb. So this is the lumbar plexus from L1 up to L4. But L4 has a connection to L5, and you know L5 is part of the sacral plexus. And you can see the different nerves given off by the lumbar plexus. Mainly the femoral nerve, which is L2, L3, L4. And we shall see that this femoral nerve is going to supply the muscles of the anterior compartment of the thigh. So one of the major nerves which we get from the lumbar plexus supplying the muscles of the lower limb is the femoral nerve, with roots L2, L3, and L4, and to supply muscles of the anterior compartment of the thigh. Then the sacral plexus from L5 up to S3 plus one root from the lumbar plexus L4 contribute to the nerve supply of most of the other muscles of the lower limb. For example, the nerve known as the sciatic nerve is the largest nerve, and it's made up of two components. That sciatic nerve is made up of two components. The sciatic nerve is made up of the common peroneal nerve and the tibial nerve. The common peroneal nerve and the tibial nerve, when you bring them together, they form what we call the sciatic nerve. This sciatic nerve supplies the muscles of the posterior compartment of the thigh, the muscles of the leg, and the muscles of the foot. It supplies most of the muscles of the lower limb, the sciatic nerve, made up of the common peroneal component and the tibial component. The common peroneal component has roots L4, L5, S1, S2. L4, L5, S1, S2. Those are the roots which contribute to the common peroneal component. The tibial component has roots L4, L5, S1, S2, S3. So it means that the tibial component of the sciatic nerve is the largest. So when they talk about the sciatic nerve, they talk about its two components from the lumbosacral plexus or from the sacral plexus. That is the common peroneal and the tibial. Bound together within the same sheath, they form the sciatic nerve, which is the largest nerve in the body. And the roots of the entire nerve are from L4 to S3. But when you specify, the common peroneal ends at S2, the tibial takes all the roots of the sciatic nerve. So let us go to the muscles of the gluteal region, which is the buttock region. And I've summarized them in the table shown here. All these are muscles of the buttock region or the gluteal region. These muscles So the biggest muscle covering all of them is the Gluteus Maximus. On top of them is the Gluteus Maximus. And you can see this muscle originating from the posterior surface of the ilium. I want you to understand this. Gluteus Maximus is on top of all the other muscles of the gluteal region. It originates from the posterior aspect of the ilium and also the sacrum. It originates from the posterior surface of the ilium. In fact, when you look at that bone known as the ilium, and I want you to go and do this, the ilium has what we call gluteal lines. Gluteal lines. Those gluteal lines demarcate the origins of the gluteal muscles. So, Gluteus Maximus originates posterior to the posterior gluteal line. Posterior to the posterior gluteal line of the ilium and the sacrum. That is where it originates from. It goes and inserts on the gluteal tuberosity of the femur. It inserts on the gluteal tuberosity of the femur and what we call the iliotibial tract. The iliotibial tract is an aponeurosis of the lateral aspect of the thigh. I will show it to you. From the ilium, posterior to the posterior gluteal line and the sacrum, it then goes and inserts onto the gluteal tuberosity of the femur and the iliotibial tract, which is an aponeurosis on the lateral aspect of the thigh. So it means that when we are looking at the osteology of the femur, you must have seen the gluteal tuberosity. And if you never saw it, go back to those bones and look at the gluteal tuberosity. And you're also going to go back to the ilium and look at those gluteal lines. So this muscle, we are going to see the nerve supply of this muscle. The nerve supply of the Gluteus Maximus is what we call the inferior gluteal nerve. And I will show you why they call it the inferior gluteal nerve. And it extends the thigh at the hip joint. You can even attempt to extend your thigh at the hip joint, and you touch your gluteal region, you will sense that muscle Gluteus Maximus contracting. When you remove Gluteus Maximus, deep to it you have Gluteus Medius. This Gluteus Medius originates between the posterior gluteal line and the anterior gluteal line of the ilium, of the posterior surface of the ilium. Gluteus Medius originates between the posterior gluteal line and the anterior gluteal line. And it will go and insert on the greater trochanter of the femur. This Gluteus Medius. It will go and insert on the greater trochanter of the femur. And as opposed to the Gluteus Maximus, which is supplied by the inferior gluteal nerve, the Gluteus Medius is supplied by the superior gluteal nerve. And it abducts and medially rotates the thigh at the hip joint. Deep to it, when you dissect it away, you have the Gluteus Minimus. The Gluteus Minimus originating between the anterior gluteal line and the inferior gluteal line. Between the anterior gluteal line and the inferior gluteal line, and it also inserts at the greater trochanter of the femur, has the same action like that of the Gluteus Medius, abduction and mid rotation of the thigh at the hip joint, and it is also supplied by the inferior gluteal nerve. So the gluteal muscles are Gluteus Maximus, Gluteus Medius, and Gluteus Minimus. So on top of all of them is Maximus. Deep to the Maximus you have Medius, and deep to the Medius you have Minimus. Now, remember I talked about the greater sciatic foramen and the lesser sciatic foramen, which were originally notches, the greater sciatic notch and lesser sciatic notch. But the sacrospinous and the sacrotuberous ligaments convert them into the greater sciatic foramen and the lesser sciatic foramen, as we saw previously. This is foramen, and this is the front view. So those foramina are very important in the gluteal region. Those foramina are very important in the gluteal region because structures move from the pelvic cavity, they pass through them, and then they enter the gluteal region. Structures move from the pelvic cavity, they pass through them, they pass to the greater sciatic foramen and lesser sciatic foramen, and they enter the gluteal region. For example, you have this muscle known as piriformis muscle. Piriformis muscle, this is the posterior view of the pelvic bone. Piriformis muscle originates from the anterior surface of the sacrum. When we go back here, I want you to pay attention. The piriformis muscle originates from the anterior surface of the sacrum. Then it passes through the greater sciatic foramen and it will enter the gluteal region. So it originates from the anterior surface of the sacrum. It passes through the greater sciatic foramen and then it will enter the gluteal region. As we are seeing, it originates from the anterior aspect of the sacrum. It passes through the greater sciatic foramen, enters the gluteal region, and inserts on the greater trochanter of the femur. This muscle known as piriformis. So is another muscle of the gluteal region. And it rotates the thigh laterally. It rotates the thigh laterally. We're going to find out what we mean by lateral rotation of the thigh. It rotates the thigh laterally. Piriformis muscle. Still deep to Gluteus Maximus. Now, let us look at this piriformis muscle. I've talked about its origin from the anterior surface of the sacrum and its insertion on the greater trochanter, and I say that it laterally rotates the thigh at the hip joint. Now, I want you to remember these nerves which are coming from the sacral plexus, from L5 to S4. These nerves are branches of the sacral plexus. For example, the nerve to Correlates femoris. The sciatic nerve is one of them. the nerve to correlates femoris, the nerve to inferior gemellus, the nerve to obturator internus. You can see these nerves. And there are other nerves known as the inferior gluteal nerve. This is the nerve which supplies the Gluteus Maximus. And the superior gluteal nerve, this is the nerve which supplies the Gluteus Minimus. These nerves from the sacral plexus, and we very well know that the sacral plexus is within the pelvis. The sacral plexus is within the pelvis. You can see these nerves from the sacral plexus are going to move from the pelvis around here, and then they are going to pass through the gluteal foramen like the piriformis, and they will enter the gluteal region, supply the muscles of the gluteal region. For example, here we are seeing the superior gluteal nerve. Of course, it is coming from the sacral plexus on the inside of the pelvis. It passes through the gluteal foramen above piriformis. We talked about this muscle of piriformis originating from the anterior surface of the sacrum. It passes through the gluteal foramen to enter the gluteal region. So another structure which passes through the gluteal foramen is the superior gluteal nerve. We need to supply Gluteus Medius and Gluteus Minimus. The reason they call it the superior gluteal nerve is because it is passing through the gluteal foramen, it passes above piriformis. Then the inferior gluteal nerve also is coming from the sacral plexus. As it is entering the gluteal region through the gluteal foramen, it passes below piriformis. That's why they call it inferior gluteal nerve, on its way to supply the Gluteus Maximus. Then the sciatic nerve, that largest nerve, also when it moves from the sacral plexus, it passes through the gluteal foramen and enters the gluteal region, and it also passes below piriformis. Then there is this nerve from the sacral plexus also, the pudendal nerve. This pudendal nerve is going to supply the genitalia and the anal sphincters in the perineum. It also moves from the sacral plexus, exits the pelvis through the gluteal foramen. But for it, it curves above the sacrospinous ligament and then goes and enters the lesser sciatic foramen to go to supply the perineum. But it will first exit the pelvis and enter the gluteal region by passing through the greater sciatic foramen. So that's why I say the greater sciatic foramen is a conduit. Through structures move from the pelvis to the gluteal region. So this muscle piriformis is supplied by the nerve to piriformis that we saw. From the sacral plexus, and that nerve also passes through the greater sciatic foramen on its way to enter the gluteal region to supply our muscle known as piriformis. And piriformis is a lateral rotator of the thigh at the hip joint. Now the other muscle is below piriformis. This is the muscle known as gemellus superior. This muscle is known as gemellus superior. It originates from the spine of the ischium, the ischial spine, and goes and inserts at the greater trochanter. From the ischial spine to the greater trochanter, and it is also a lateral rotator of the thigh at the hip joint. It is known as gemellus superior. And we have talked about it in the table. You will go and talk about it more. That nerve known as gemellus superior. So it also has its nerve there. The nerve which supplies gemellus superior, we are going to see that it also supplies the obturator internus. It's coming from the sacral plexus. And this nerve also must pass through the greater sciatic foramen from the pelvis to enter the gluteal region. Then we have this other muscle known as the obturator internus. When you look at the pelvic bone has this opening known as the obturator foramen. The obturator foramen. There are two muscles attached to the obturator foramen, and I want you to pay attention. There are two muscles attached to the obturator foramen. One is attached to the obturator foramen externally, known as the obturator externus, and the other one is attached to the obturator foramen internally, known as the obturator internus. So the muscle attached to the obturator foramen externally is obturator externus, and the muscle attached to the obturator foramen internally is the obturator internus. So this muscle, obturator internus, originates from the inner aspect of the obturator foramen. It originates from the inner aspect of the obturator foramen. That's why they call it obturator internus, as you can see there. Then it passes through the lesser sciatic foramen, and it is going to go and insert on the greater trochanter. It is also a lateral rotator of the thigh or a hip joint. And the nerve which supplies gemellus superior and obturator internus is the same. Then there is another muscle which originates from the iliotibial, known as gemellus inferior. Gemellus inferior originates from the iliotibial. It goes and inserts on the greater trochanter. I think now you see that the greater trochanter is a very, very important landmark, because all these lateral rotators and these two gluteal muscles attach there. So gemellus inferior from the iliotibial goes and inserts on the greater trochanter. It's also a lateral rotator of the thigh and the hip joint. Then we have this muscle known as Gluteus femoris, originating from the iliotibial and inserts in the intertrochanteric line, where we have what we call a quadrate tubercle. This is the greater trochanter, this is the lesser trochanter, and the line, the ridge between them is the intertrochanteric line, where we have the quadrate tubercle, where Gluteus femoris inserts. And Gluteus femoris is also a lateral rotator of the thigh. The nerve which supplies Gluteus femoris is the same nerve which supplies the gemellus inferior. The nerve which supplies obturator internus is the same nerve which supplies gemellus superior. And these muscles are the muscles of the gluteal region. Their nerves are going to move from the sacral plexus in the pelvis They are going to pass through the greater sciatic foramen with the piriformis, and then they are going to come to the gluteal region to supply these muscles of the gluteal region. One of two nerves, one known as the superior gluteal nerve, supplying gluteus medius and minimus, they pass through the greater sciatic foramen but above piriformis. That's where the word superior comes from. And inferior gluteal nerve passes through the greater sciatic foramen below piriformis. That is where the word inferior comes from. It supplies the gluteus maximus. And the nerves to gemellus superior, obtutor internus, gemellus inferior, quadratus femoris, all of them will pass through the greater sciatic foramen below piriformis to come to the gluteal region to supply these muscles. So we have looked at the muscles of the gluteal region. We began by looking at Gluteus Maximus, below which we found Gluteus Medius, Gluteus Minimus. Then we went to the Gluteus Maximus. We said it extends the thigh at the hip joint. The Gluteus Medius and Minimus, we said they abduct the thigh at the hip joint and medially rotate it. And then the piriformis, the gemellus superior, the obtutor internus, the gemellus inferior, and the quadratus femoris, these ones rotate the thigh laterally and the hip joint. And those are the muscles of the gluteal region. The sciatic nerve does not give off any branch in the gluteal region, but it passes through the gluteal region on its way downwards to the thigh, where it is going to be supplying muscles there. But we talk about it because it is a content of the gluteal region. It exits the pelvis from where it is coming from the sacral plexus, passing through the greater sciatic foramen below piriformis. It's a very important nerve. This is the nerve which is injured by intramuscular injections of the gluteal region. So clinicians are trained to know the position of the nerve so that they avoid it. And this sciatic nerve is accompanied by the posterior cutaneous nerve of the thigh. And when you hear the word posterior, it means it supplies the posterior aspect. Cutaneous, it supplies the skin. Of the thigh, it supplies the posterior aspect of the skin of the thigh. It also accompanies the sciatic nerve as it is entering the gluteal region through the greater sciatic foramen below the piriformis. Remember, these nerves are accompanied by blood vessels. For example, the superior gluteal nerve is accompanied by the superior gluteal artery, branches of the internal iliac. The inferior gluteal nerve is accompanied by the inferior gluteal artery. The pudendal nerve, which exits the pelvis to enter the gluteal region through the greater sciatic foramen and then curves and goes back to the perineum through the sciatic foramen, is also accompanied by what we call the internal pudendal artery and internal pudendal vein. The vessels are internal pudendal, the nerve is pudendal. So these nerves are accompanied by vessels. And it will do you good when you go and look at the gluteal region in detail and muscle by muscle, as I have mentioned there. You can see our piriformis, you can see our obtutor internus. From the inner aspect of the obtutor foramen, it passes through the lesser sciatic foramen and enters the gluteal region and goes and inserts on the greater trochanter. You can see our gemellus superior from the ischiospine and gemellus inferior from the iliotibial, inserting at the greater trochanter. And this piriformis, this obtutor internus is the one which you find in between these two. So for it comes from there, from the obtutor foramen, and then it passes through the lesser sciatic foramen. And when you look at it, it's passing between the gemellus superior and gemellus inferior, as I indicated here. And see, the obturator internus is passing through the gemellus superior and gemellus inferior. But what you must know that originates from the inner lining of the obturator foramen, it passes through the lesser sciatic foramen and enters the gluteal region and inserts on the obturator trochanter. You can see our Correlates femoris originating from the iliotibial and inserting on the quadrate tubercle, which is between the gluteal trochanter and the lesser trochanter. These are the muscles which are known as the lateral rotators of the thigh. So piriformis, gemellus superior is there, obturator internus, which passes there, gemellus inferior, which is there, and quadratus femoris is there. They are the lateral rotators of the thigh. The gluteal muscles are Gluteus Maximus, deep to it, Gluteus Medius, and deep to Gluteus Medius you have Gluteus Minimus. When you look at the pelvic bone, you're going to go and look at the pelvic bone, and you go to the ilium on the posterior aspect. This is what we call the posterior gluteal line. And I say that behind it, that's where the Gluteus Maximus originates from. This is what we call the anterior gluteal line. And between the posterior gluteal line and anterior gluteal line, this is where Gluteus Medius originates from. Then between the anterior gluteal line and the inferior gluteal line, which is obstructed here, that is where the Gluteus Minimus originates from. You'll go and look at those gluteal lines. This is a summary of the lateral rotators of the thigh: piriformis, gemellus superior, obturator internus, gemellus inferior, quadratus femoris. And they attach to the greater trochanter of the femur, and then they contract, they laterally rotate the thigh at the hip joint. So this is just showing you the inner aspect of the pelvis and the greater sciatic foramen, showing you how the nerves, this muscle is piriformis. You can see the superior gluteal artery, superior gluteal nerve pass above piriformis, and the rest pass below piriformis as they are exiting the pelvis to enter the gluteal region. So you can see our sciatic nerve entering the gluteal region by passing through the greater sciatic foramen. Now, the buttock region or the gluteal region is divided into 4 quadrats. We have the upper medial quadrant and the upper lateral quadrant. We have the lower medial quadrant and the lower lateral quadrant. I repeat, the gluteal region is divided in 2 quadrats. The upper medial quadrant, the upper lateral quadrant. The lower medial quadrant, the lower lateral quadrant. And you find that our sciatic nerve is in the lower medial quadrant. So injections are not administered in the lower medial quadrant, because when you inject in the lower medial quadrant, you are likely to inject in the sciatic nerve and cause paralysis of the muscles of the posterior compartment of the thigh, the muscles of the leg, and the muscles of the foot, which is going to disable your lower limb completely. So the needle for intramuscular injections, we inject in the upper outer quadrant to avoid injury to the sciatic nerve. These branches of the superior gluteal nerve are like threads. They are very small and they're difficult to injure. So that is why they say the upper outer quadrant is the safest region of the gluteal region, where you can administer intramuscular gluteal injections and avoid injuring the sciatic nerve, which is in the lower medial quadrant. This is something simple, and no one should forget it. So this is the safe region, the upper outer quadrant, for administration of the intramuscular injections in the gluteal region. Avoid the lower medial. So the vertical line and the horizontal line, which demarcate the gluteal region in two quadrants, are going to intersect between the greater trochanter and the posterior superior iliac spine, between the greater trochanter of the femur and the posterior superior iliac spine. In between these two landmarks, that is where the vertical line and the horizontal line, which form the quadrants of the gluteal region, intersect. So always inject in the upper outer quadrant because it is the safest region for the administration of intragluteal region, avoiding injury to the sciatic nerve. Now we talked about these two muscles, Gluteus Medius and Gluteus Minimus. Gluteus Medius and Gluteus Minimus. Gluteus Medius and Gluteus Minimus are supplied by the superior gluteal nerve, and they insert at the greater trochanter of the femur. And we say that Gluteus Medius and Minimus abduct the thigh at the hip joint and also medially rotates the thigh. They medially rotate the thigh at the hip joint and also abduct the thigh at the hip joint. The other function or the other action of these muscles, is that when you are standing on your lower limb, and I need you to understand this, when you're standing, the Gluteus Medius and the Gluteus Minimus contract. When you're standing, the Gluteus Medius and Gluteus Minimus contract. And when they contract, they cause the head of the femur to get firmly inserted into the acetabular fossa. In other words, the contraction of Gluteus Medius and Minimus when you're standing are going to stabilize the hip joint in a way that they force the head of the femur to get firmly inserted into the acetabular fossa. So in that way, when you're standing, they stabilize the hip joint and prevent dislocation of the head of the femur when you are standing. And this is what I'm talking about here. So you can see that these muscles, Gluteus Medius and Gluteus Minimus, when you're standing on one limb and lifting the other, all the weight is on this limb and on this joint. When these muscles contract, the Gluteus Medius and Gluteus Minimus, it allows or it forces the head of the femur to get firmly inserted. Their contraction causes the head of the femur to firmly insert in the acetabular fossa and stabilize this joint, such that when you're standing on this joint, when all the weight is on this joint, it does not dislocate because of the contraction of the abductors of the thigh, which is the Gluteus Medius and Gluteus Minimus. They stabilize this joint so that it does not dislocate when all the weight is exerted onto it. And you find that this hip joint, much as it does not, there's no weight on it because this limb is being lifted. And this hip joint, which has weight, will still remain at the same level because there is no dislocation. This one has been stabilized by the contraction of these muscles, so the head of the femur does not dislocate out because of the weight, such that even when this limb is lifted and the weight is exerted on only this one, these two joints will still remain at the same level. But when the superior gluteal nerve is injured, the gluteus medius and the gluteus minimus are going to paralyze, such that they can no longer contract. Now, when you stand on this side which is affected, because of failure of contraction of the gluteus medius and gluteus minimus, the stability of the hip joint is going to be compromised, such that when you stand on this affected side, there is dislocation of the femur, such that this hip joint slightly moves superior than this one. Every time you stand on this side which is affected, this joint is going to dislocate superiorly, such that it's not at the same level with this one. When this happens, we call this a positive Trendelenburg's sign. A positive Trendelenburg's sign. It is as a result of the dislocation of the hip joint on one side, as a result of paralysis of the gluteus medius and gluteus minimus, which we are causing its stability, and such that when you stand on that joint, it dislocates superiorly above the joint on the opposite side because it is unstable. But if the muscles were contracting, the positive Trendelenburg sign will not occur, because the contraction of these muscles will stabilize this joint. There will be no dislocation, and it will remain on the same level like the joint on the opposite side. So you see a positive Trendelenburg sign here. This joint has dislocated superiorly because the gluteus medius and minimus have paralyzed. They can no longer stabilize this joint. So when you stand on this side, this joint dislocates superiorly above the opposite. But if it wasn't the case, these two joints will be at the same level.